80%. 80% of the cholesterol clogging your arteries does not come from food. It is produced right here inside your body, by your own liver. If you already cut out eggs, avoided meat, and your LDL is still through the roof, you were fighting biology in the wrong direction. I'm a cardiologist, and in this video, I'm going to show you how to use science in your favor to lower cholesterol in record time, without giving up everything you enjoy. Before anything else, subscribe to the channel and turn on notifications. Every week, we post evidence-based cardiology content, exactly the way your heart deserves. Think of your liver as a factory that never stops. One of its most important jobs is producing bile, a kind of natural detergent your body uses to digest fat. And guess what the number one raw material for this factory is? Cholesterol. Bile leaves the liver, does its job in the intestine, and at the end, the body tries to recover that cholesterol to use it again. It's a perfect recycling cycle. The problem? As long as this cycle keeps spinning non-stop, old cholesterol continues circulating in your bloodstream. So the real secret to lowering LDL is breaking this recycling cycle. And the most powerful tool for doing that is not an expensive medication. It's something you can find at the grocery store for just a few dollars. Oats. When you eat oat bran, the fibers form a gel inside your intestine. That gel works like a net that traps bile before it can be reabsorbed. Instead of returning to the liver with cholesterol, that bile is naturally eliminated by your body. And this is where the biological magic happens. Without bile to recycle, the liver needs to make more. To do that, it looks for raw material. And where does it find it? In the excess cholesterol floating in your bloodstream. The liver opens more receptors, captures LDL from circulation, and uses it as replacement material. Your lab results improve, without you doing much more than eating oats in the morning. The practical recommendation: 3 tablespoons of oat bran per day. Bran, not flakes. The concentration of beta-glucan fiber is much higher. Now I need to correct the mistake I see most often in patients. They cut fat from meat and compensate by filling their plates with white bread, white rice, cookies, and boxed juice, thinking they're making the healthy choice. Cardiology guidelines are very clear. Excess sugar and refined carbohydrates are just as dangerous as saturated fat. Here's what happens inside your body. Every excess spike of sugar in the bloodstream triggers insulin. Insulin tells the liver to turn that sugar into fat. The liver packages this fat into a particle called VLDL and releases it into circulation. With too much VLDL in the blood, fat metabolism becomes overloaded. Part of that VLDL turns into smaller LDL particles, the most aggressive kind for your artery walls. In other words, you can have a normal LDL on your blood test and still have a very high cardiovascular risk. To break this cycle, you need to lower insulin, and the fastest way to do that is cutting out what spikes it the most: sugar, refined flour, and soft drinks. There is a group of compounds found in vegetable oils, seeds, and nuts that works very intelligently inside your intestine. They are called phytosterols. Their structure is so similar to animal cholesterol that your intestine cannot tell them apart. When you consume enough phytosterols, they occupy the absorption sites first. Dietary cholesterol is left without space and gets eliminated. Strong clinical studies show reductions of up to 10% in LDL within just a few weeks simply by adding these foods. Where can you find them? Extra virgin olive oil, avocado, flaxseed, sesame seeds, walnuts, and nuts. The goal is to consume at least 2 or 3 of these every single day. If you made it this far, you already know more about cholesterol than most people. Share this video with someone who needs to hear this. It could save a life. You open your blood test and go straight to LDL. That makes sense. It's the number one target. But there are 2 other markers that can reveal a risk LDL alone may hide. The first is LPA, lipoprotein little a. Imagine an LDL particle carrying an extra backpack on its back. That backpack makes it a much more aggressive molecule. And the most important detail? It's 100% genetic. Diet and exercise do not lower LPA. If you have high LPA, the strategy changes. We need to compensate by pushing LDL even lower, below 100, sometimes below 70, or even 50, depending on cardiovascular risk. The recommendation is to measure it at least once in your lifetime, especially if you have a family history of early heart attack. Pause 0.5 seconds. The second marker is ApoB, apolipoprotein B. LDL measures the weight of cholesterol in the blood. ApoB measures the actual number of particles. And that changes everything. You can have an LDL of 100, apparently normal, and still have an excessive number of particles damaging your blood vessels. This is what we call residual risk. Diabetics, people with obesity, and those with high triglycerides are more likely to have this pattern. Ask your doctor for this test. About HDL, the good cholesterol, science is very clear. People with HDL above 50 have far fewer cardiovascular events. But when we tried increasing that number artificially with medication, it didn't work. The only effective and proven way to raise HDL is through lifestyle. Regular physical exercise is the most powerful tool. The guideline recommendation is 150 minutes per week of moderate activity. You don't need a gym. A brisk walk already gets the job done. So let's recap the complete action plan. 1. 3 tablespoons of oat bran per day. 2. Cut sugar, white flour, and soft drinks. 3. Include olive oil, avocado, flaxseed, and nuts in your routine. 4. Ask for LPA and ApoB in your next blood test. 5. 150 minutes of exercise per week. And if your doctor prescribes statins or ezetimibe, do not stop the treatment. Use these strategies to maximize the medication's effect. The goal is not to be against medicine, it's to maximize your results using evidence. Do all of this and your next blood test will tell a very different story. If this content was helpful, leave a like and comment which of these strategies you already use. I'd really like to know. Subscribe to the channel because here we talk about evidence-based cardiology. See you in the next video. God bless you.